Alright, this is just going to be a quick video, guys. I think a lot of people sometimes they ask, what do I do after I'm out of back pain? And my answer is there's a lot of things you can do. I think consistency is a big key, and I think trying to do something on a 3 to 4 times a week basis is a very good thing. Now I'm just going to go over some basic stuff that you want to pick and choose or do all of them, and what I would recommend is try to do these like 3 or 4 times a week. Remember, if you've ever seen me before, I'm really always harp on that co-contraction. So whenever you're performing any of these, what you want to try to do is to keep your back and torso in a straight, rigid position, with the exception of one of them I'm going to show you. But you always want to try to keep this tense by imagining you're going to get hit in the gut. That sort of tension, you want to crank that to about 10 degrees of intensity, and then from there you also want to try to imagine as though your abs are trying to tense and grab around into your back as well. So you want to feel secure and tense in both these positions or places as you perform these. So without further ado, I'm just going to go and perform 3 to 4 repetitions of each thing, and then I'll give you some numbers outlined afterwards. So a couple standing I would do every day. A simple hip hinge with a cue on the back. You want it touching the back of your spine, between the shoulder blades and the back of the head. Feet are placed out at about hip width without bending the knees. You want to try to translate your hips backwards while tensing the core and trying to get a stretch through the hamstrings. And as you come up, you want to really focus on driving your body back upright by using your hamstrings and your butt. So
you also want to keep it touching the top of your butt.
So once again, here's some simple repetitions of that. Now you can also translate this into performing, and I'm going to perform it rather poorly, a squat. Once again, all 3 positions. And focusing on driving with the glutes as you come back up. So there's 2. If you can't do a squat, you can simply just try to do some knee bends. Once again, this is constant activation of this torso and the lower spine. So from there, we're going to do some floor routine. So one of my favorites, you can either perform a side plank holding, or a plank not modified is simply straight out. Now with both of these, what I would try to do is to get to the point where you feel shaky or wobbly and hold it for about 5 to 10 more seconds after that. And then from there, this is the one I'm going to tell you maybe not to tense so much, but cat camel, where you're imagining a string is hooked through your lower back, and you're going to pull that string upwards. And as you pull, your head comes down, and your glutes come forward. So you're engaging the glutes as you do this. And in the second position, head comes up, belly drops, and a breath in. So breathe in, or breathe out. Engage the glutes. Head goes down, and that pull goes up. Come down, breathe out. Alright, and last but not least, a simple 4-point quadruped or a bird dog position. So same position, engaging the core. Simultaneously, both the leg and the arm go outwards. Doesn't necessarily need to be in an arc. You're just doing it straight. And what you're trying to not have occur is a wobble or a pull of the hips outwards. And you also want to try to keep your hips in a perfect line. I don't know if I'm doing them well, but a good gauge of it, you could get a book or like a pole. You can put it across your back and see if that falls off. And that's it for now.
This is Dr.